Hello, I'm Elena Torrell, I'm 23 years old, and I've studied the social financial costs of alcohol consumption in Catalonia. Together with scientists and experts working on alcohol in Barcelona, we have been trying to answer the question, how much does alcohol consumption cost us as a society? Our study estimating the total social financial costs of alcohol in Catalonia, just Catalonia, came up to a total of 555 million euros in 1 year. When I decided to study public health, I chose to estimate the financial costs of alcohol consumption as a topic for my master thesis. The team was led by Joan Colom, director of the subdirectorate, and Jurgen Rehm, senior expert scientist.
Para nosotros es fundamental disponer de una nueva generación de profesionales y que es el caso de, por ejemplo, de Elena. Necesitamos profesionales bien formados que aporten nuevas metodologías, nuevas visiones y nuevos criterios para modificar, cambiar y adaptar la realidad que siempre es constante y dinámica en el ámbito de las adicciones.
When I was working on my thesis, I was in the Generalitat of Catalonia about 3 days during the week, and the remaining going to uni. We had regular meetings with the epidemiology team, where we would discuss indicators and data that was needed for the research. Also, I had one-to-one meetings with Lydia Segura, who was my support professor for the thesis. She would be Lydia, who is the person I would go to for alcohol-related questions, so Joan would be in that office.
It was really a nice surprise that a person not coming from the public health area was able to adapt so quickly and to understand quickly all the methodological elements and also be autonomous and work directly with someone like Jurgen Rehm.
I have to say at the beginning I wasn't aware of how big of a magnitude he has within his field, within alcohol, and how in the end of my thesis I ended up making half of the references to probably his papers.
It was really a humongous job to organize and get all those data ready, thinking outside the box, using not only routine data but research projects, etc.
Our research, we divided the costs into 2 categories, direct and indirect costs. The first category, the direct costs, were hospitalizations due to alcohol, accounted for the biggest part of this. The second one, indirect costs, includes the loss of productivity, which could be due to dying prematurely, and as well the days that a person was hospitalized and therefore couldn't go to work. So those 555 million euros, which is a lot, would be a conservative proxy of actually the total cost of alcohol consumption. For many politicians and even part of society, in a region like Catalonia, a common argument is that alcohol should not be controlled too strictly because tourism is too important for the economy, but the costs, the losses to the region, are normally not taken into account from a social and economic point. That's what we try to do with this research.